Hi, it's Kathy again. This is probably one of the last times you'll see me with makeup on because, to be honest, being vain really is a pain in the butt. It just takes far too long. So, you get what you get, okay? Alright, hopefully this will be a little bit better video than the last one. I did want to touch on a few things that have happened since the last time I made the video. I have seen the cardiologist, and although he can't confirm any blockages, I do have reduced blood flow to the muscle around my heart. So he has referred me to the hospital to get an angiogram. It's where they stick a tube in your thigh and your groin and go up into your heart and inject dye and track where the blood flows and see if there are any blockages anywhere. So hopefully they will find if there's anything wrong, because they're not going to do the gastric bypass surgery if I have heart issues. So hopefully we can get that straightened out. I have my new compression stockings, which are absolutely outrageous in price. But as I said in the last in the last video, I do believe that I have lymphedema, so the compression stockings are just a lifesaver. They're a pain in the butt to put on. My poor husband has to put on these rubber gloves. They look like the yellow dishwashing gloves, only these are blue, and they're specially designed to grip the stockings because they're really thick and pretty stiff, and they're kind of difficult to put on. Poor guy. But God bless him. He does so much for me. It's just unbelievable. So, I have the compression stockings, but unfortunately I had a new issue crop up within the past 2 weeks. I was getting in the car and there was a broken screw that was holding some plastic pieces together. It's hard to explain, but there was a piece of broken plastic that was exposed, and it scratched my leg as I got in the car. Well, the larger my legs get with water, the harder it is to judge distance when you're walking somewhere or getting into places, and my leg hit it, and it bled a lot at first. It's about 1.5 inch long gash. Not gash, but it's a cut. It was open. Then the weeping started. Oh boy, the weeping started. It was pretty intense. I mean, we were changing the bandage every 12 hours and it was completely saturated. So, and then, of course, you may not know that with lymphedema, with the water just sitting there, becoming stagnant, for lack of a better medical term, the possibility of infection is pretty massive, even without a cut. But once you break the skin, then you've got the possibility of an infection with like gargantuan possibilities. It's really, really dangerous. So I was trying to take care of the cut as best I could, keeping it clean, keeping it covered, and so on and so forth. But then I noticed that it was really starting to hurt. So I went to the clinic. My doctor was on vacation, so I went to the clinic, and the clinic doctor told me that I should leave my compression stockings on and only take them off to change the bandage. So, okay, I left the stockings on, only taking them off once a day to change the bandage and switch socks or stockings. And last night we did a bandage change, and there was, now it's almost been a week and a half since I cut my leg, and there was blood, which shouldn't have been there, and it was definitely infected. There was some not so nice stuff on the bandage when we took it off. So I decided nothing I can do on a Friday night, and it's the weekend, so I said, screw it. I'm going to leave the stockings off, take the bandage off, wash it really well, peroxide it, put the antibiotic cream on it, and leave it open. Of course, with all the weeping, I tied a tube sock around my ankle. Sorry, a tube sock around my ankle, and to catch the weeping. So, and surprise, 24 hours later, it looks 100% better. Sometimes you have to be your own doctor. I'm not saying take risks, but use common sense. Common sense told me that covering a wound that continues to become infected is just not a good thing. So you leave it open, just like what your mother used to say, let the air get at it. She's right. She's right. It works. I don't know why doctors don't tell you that. The air is not a bad thing. So, I also talked to my doctor last week about going to see a different vascular specialist to get the diagnosis of lymphedema, so then I can start going to this other program to get the stockings and the massages, getting help with, whatever I need help with. So that she absolutely agreed. She gave me the referral, and I go see that doctor next week, I think. Maybe the week after. I don't know. I'm just excited to have the appointment. Now, I decided that today was going to be the day that I showed a picture of my legs. I'm not going to show you my legs, but I'll show you a picture. I decided that I would do this for a couple of reasons. Number one, I need to become humble and be proactive and be progressive. I don't want to hold myself back from getting any help that might be out there. I don't want to be vain and say, oh, I'm fine and I'm not going to show anything and I'll just cover it up and nobody will know. That's just crazy. That's crazy. I think that it would be healthy for me to be completely open and honest, say what I think, mean what I say, and show the pictures. So, who knows? Somebody out there might be watching me right now saying, wow, it sounds like I have the same thing. Oh, look, I do have the same thing. And then somebody can start getting help for their issues before it gets too bad. So that's what I'm going to do. And the reason that I had to wait so long before I got help, I knew I had a problem long ago, but I didn't have health coverage. So I just got health insurance here in November. So that's when I started really diving right in head first, so to speak, to the testing pool and getting all these things done. So here, I hope it shows up. I don't know if it will. On my little Christmas present, my tablet. I love you, honey. So let's see if you can see this. Yep. Those are my legs. And you can see my feet are pretty much a normal size. And I think I said in the last video that I never take my shoes off. And I'm not kidding. I never take my shoes off. Now here is a picture of, what is that? My left ankle with a tape measure, or you know what I mean. 20 inches is my ankle. That's pretty huge. And this is my left leg, which is about 32.5 inches. My calf, it's about 32.5 inches. My right leg is 33 inches. And you can see it's becoming deformed down here. It's, I'm pitting, getting bumps. It's not pretty. It's not pretty at all. But I want to show you, excuse me, pictures of what the first vascular specialist said that I had. He said I had venous insufficiency, and I have pictures of that too. As soon as my tablet decides to cooperate with me. This is venous insufficiency. It shows a discoloration in the skin, lots of varicose veins. It looks almost like a flesh eating. But if you notice, the leg is pretty much a normal size. That's totally not me. The other thing I wanted to show was this woman I found online has lymphedema, because you never, once you get it, you always have it. She found a treatment for it. Now the top two pictures are before the treatment. The bottom two pictures are after the treatment. And I think you can see a pretty dramatic change between the top and the bottom pictures. She lost 65 pounds of fluid out of her legs in just 2 weeks of treatment. 65 pounds of water. Gee, I wonder where that 200 pounds that I packed on during the past 2 years, I wonder what all that is. You think maybe it's water? Being, because my legs are freaking huge. This is a person with lymphedema in one leg instead of both. It can happen in your arms. It can happen in your legs. It can happen on your neck. It can pretty much be anywhere. And I even saw a picture of a puppy with lymphedema. A puppy. How sad is that? Anyways, I guess that's it for now. I don't have anything new on the gastric bypass front except that I have to go in for the angiogram. And there's blood work involved. Pretty much that's stagnant until the 26th when I have the initial orientation. I guess that's it for this week. And as soon as I have new updates, I will definitely post a new video. Thanks for watching, and have a great day. Bye-bye.